We move on. Now we go to Taraleen Malcolm, a professional in non-communicable diseases and mental health in Tahoe in Trinidad and Tobago. You have the floor. Good afternoon. Go ahead.
Good afternoon. Good afternoon, everyone. And thanks to the PHE team for inviting me to be part of this meeting today. Many times when we talk about emergency preparedness and response, we tend to focus more on our communicable diseases. We have systems in place. Mauricio went through highlighting, our surveillance system to detect these foodborne, waterborne, vector-borne conditions. But many times we don't really focus on NCD and mental health. And I think one of the biggest lessons learned from the COVID-19 pandemic is the fact that the issues are so interconnected. So we have to take a holistic approach if we really want to build the resilience of the population. But quickly, just a reminder as to why NCD and mental health consideration must be part of our preparedness and response action. We know that NCD have common characteristics that can that affected persons are more vulnerable during an emergency, and emergencies tend to increase the risk of NCD-related complications. We also have found that just like any other condition, people with NCD usually required ongoing treatment, and this treatment may be interrupted, resulting in that increased risk for other complications. We have also seen from past experiences, such as hurricanes, that the impact that they have had on mental health. And we have seen that COVID-19 pandemic has really brought to the forefront the importance of mental health and taking mental health consideration in our planning and in our response. We know that on average, the incidence of mental health problem increases among persons post-emergency events. And we also know that emergencies tend to exacerbate and trigger relapse in people with pre-existing mental health problems. So based on that, we know that person with NCD and mental health constitute a special group. There are special needs that we have to prepare and take into consideration. So in our preparedness phase, we must ensure that we incorporate NCD and mental health consideration in our national disaster response plan. It must be part of our planning process. And we are all reminded by the Sendai Framework for Disaster Risk Reduction 2015-2030 that indicated that people with life-threatening and chronic disease due to their particular needs should be included in the design of policies and plans to manage their risk before, during, and after disaster, and ensuring that they have access to the life-saving services. So we should develop specific plans for people with special needs. And the community level is the most appropriate setting because communities are different. The context may be different. The solutions or the guidance that may be required may vary depending on the hazards that impact on a particular community. So it's important that we, in developing these measures, we look within that context, within that community, and we incorporate these general guidelines into our response plan at all levels. I think Mauricio and Ken mentioned earlier about the coordination and the importance of coordination. And it's just as important for NCD and mental health. If we don't know the stakeholders prior to the event, it's very difficult then to have a coordinated response. So we recommend that you need to complete that 4W matrix as it relates to NCD or mental health and psychosocial support services. So it is knowing who is doing what, where, and when. And that gives us that bigger picture and will help us to know during and post the event where the service gaps may exist, the groups that may require special attention and support during and post the event. So in our pre-planning, first and foremost is to avoid the disruption of the health services. And we know that this cut across all areas, not just NCD and mental health, but all program areas. And this is why that smart health facility, and I think Alex spoke about that resilient health facility. We have to ensure that that program is being implemented. We are doing the assessment of the facilities, and we're able to do the necessary retrofitting to align them to be able to remain functional. But of course, especially in the Caribbean, we know that there are some facilities based on their location, there already has certain hazards such as flooding that may hinder access to the facility post the event. So we have to have those contingency plan. So and this must be communicated so person know exactly where services may be available in case this particular facility is not able to provide that service. And the shelter, again, Mauricio mentioned that the important role that shelters play. So in our planning process, we have to ensure that there are standard operating procedures on who to contact for medical treatment or for medicine, when and where to refer people with NCD and mental health issues while they're staying in the shelter. And importantly, in preparing for emergency, we always have our community level preparedness. We have our public education campaign, and it's important that we integrate messages around preparing to go to the shelter, or even if you're not going to the shelter, that preparedness to ensure that persons have additional supply of medicines and certain instructions are given. Again, this is where we have to focus on self-management, building the efficacy of persons to be able to manage their condition so that they are already at a stage that they're properly controlled and will not severely be at a higher risk for complication. So in our initial phase, we have to continue to give and provide the care to persons who are in the shelter, but we also have to consider that there are persons in the community that may be isolated, may be cut off, may not be able to reach the facility to gain access to these services. So we have to plan as part of our contingency what facilities or what services may be able to reach these groups that may not be able to access the service at the facility. And of course, we have to activate that coordination mechanism so we get to understand who are the persons that are doing what, when, and where. And in that early recovery is just that continuation of providing the services required. There are some persons that may have received service at the community level, and now it's time to transfer them back into the routine health system. We also, most importantly, we have to prioritize psychosocial support for individuals who are operating in these conditions. And we need to train our first responders and other community members in psychological first aid so that they are able to then provide that immediate first contact to persons, and there has the appropriate referral system in place that persons can be transferred to if there is need for specialized care. So basically, these are just within the 5 minutes that I had. These are just a few of the practical actions that can be taken during the different phases of the emergency to respond to the needs of persons with NCD and mental health. But we have to keep in mind that our mental health is transient. So providing mental health and psychosocial support services must be readily available and accessible to the general population. So it's not just those with known mental health condition, but generally be readily available to all. Thanks, Leo. Back to you.
Thank you, Dr. Taraleen. It's a very important aspect, very comprehensive presentation.